Welcome back to Talk 1260 KTRC. This is Western Medicine. I'm Daniel Ronel, and I have a very, very special guest here today. Why don't you tell us who you are?
Hi, I'm Tess DeGange. I am a certified reflexologist here in Santa Fe, New Mexico.
And where are you from? Where did you come from? How'd you get here?
Good question. I moved here from the Netherlands. And yeah, for the weather, absolutely.
And where did you do your training?
Well, exactly. I did my training in the Netherlands and in Thailand. They're similar in theory, but just slight differences, and I like to combine them.
Okay, so what is it you do?
I'm a certified reflexologist.
And what is that, please?
I make you feel good. I rub your feet. There are specific points on the feet that apply to organs throughout the body.
Aha, sort of like acupuncture, acupressure?
Acupressure, exactly.
Okay.
We use a lot of the same points that they use.
Mm-hmm.
So the misconception is that it's the same as massage, but it's not. There are over 7,000 nerve endings in the feet that correlate to every organ and cell in your body. They're doing research now. They're hooking up the body to an MRI and pressing points on the toes, and the big toe is the head. And by pressing certain points on just a toe, it's showing up, little lights are coming off in the brain. It's amazing.
I love that.
I love that too.
So how do you incorporate that into my surgical practice?
Well, originally, when we spoke, I pictured myself as working with your patients pre-op, relaxing them. But in hindsight, my work really benefits your patients post-op.
Right.
I speed up their recovery time by 2/3.
Really?
Yes, and on top of that, less medication is needed.
Absolutely.
So.
Okay, so how do you do it? How do you actually do it in the office? What do you do?
My work is health-wise beneficial, but I want to pamper them. So we have a beautiful room at Whole Being. I lower the lights. I use therapeutic music.
That's the other name for my office, by the way.
Whole Being, yeah. Therapeutic music, and I use organic essential oils, which also help boost the immune system.
And why does that speed up recovery time?
I'm stimulating the circulation in the body. So a lot of times when we get these aches and pains, it's because the blood is having a harder time moving through those points. So what I'm doing is I'm forcing the blood to move faster. Hence, it's pulling out toxins, which is what you want to do. It's relaxing the body, which the body heals itself really through sleep. So when we are more relaxed, our body has a better chance to heal itself.
What are the biggest benefits you've seen that my patients have?
Well, I can't really see the benefits in them because I can't walk within their shoes, but the biggest difference I see is when they walk into the office, they walk in, I guess, normal, they float out. They're as if they're in a meditative state. Most people have not had reflexology. They'll get a little bit of work done on their feet in a full body massage, but a full hour it just pumps up the endorphins so much that you almost should have a driver bringing you home.
Can you think of a real success story that you've had? I can remember one, but let's see if you think of it.
One that I think of is when I actually got to work with you in the room. You were doing, it was not in the operating room, but it was at your office.
Right.
And your patient had her hands clenched when we started working on her. The minute I put her feet in my hands, her hands just relaxed. And to me, that said it all.
Absolutely. And you've kindly gone to see some of my cancer patients in the hospital to help them recover.
Yes.
And that was great.
That was fabulous too. I remember the nurses even saying, "Oh, Tess, thankfully you're here again." This patient smiles. Smiles when I walked in.
That was great.
I loved it.
Okay. So Tess, reflexology, tell us a little bit about it. How long has it been around? What's its origin? And how does it fit into the 21st century?
Excellent question. Reflexology has been around for ages. The Egyptians were doing it. The Asians have been doing it for hundreds of years. They use it as a preventative form of medicine.
Ayurvedic medicine in general is more of a preventative than curative.
Correct.
Right, which is so much better. I mean, that's the way medicine is going in the United States these days.
Absolutely. Well, yeah, let me tell you, millions of dollars of research going into reflexology today. Michigan State University has put in $3 million to research reflexology and chemo. Dr. Oz, the heart surgeon, he is that right? Well, he got involved in complementary medicine because of reflexology.
Really?
He uses it on every one of his heart patients. Love it.
No, I saw him do that when I was rounding at Columbia as a surgical resident. That's sort of one of the things that got me into this whole field.
Excellent. Well, so we think it's new, but it's been around forever. However, thanks to doctors like you, it's being brought out to the forefront. For instance,
It's Betsy's the one who found you.
I know. You know, your smart wife here.
Thank you.
I got to work on you. It's absolutely true. I got to work on you, and you went back to your husband and said, hello.
Right, exactly, exactly. Okay, just get
What am I
credit
jumping
where
over?
credit's due.
That's right.
All right.
But you were smart enough to pick up on it.
Okay.
Yeah.
And I feel honored to be able to work with you and all the other staff at the center. So.
Okay, well, great. So Dr. Oz uses it for his heart patients. I use it for my plastics patients. There's all this research going on. Can you tell us what are the top 3 things that reflexology is offering?
It offers stress release, which enables the body to heal faster. It stimulates blood circulation, which pulls toxins out.
And what's the third?
I would say the third benefit from reflexology is it makes the patient feel better. And as we know, a happy cell is a healthy cell. And then that's one of the things that your patients do comment to me about your whole being approach to plastic surgery is that you take the time to listen to them. Not just about their looks, about everything that's going on in their life. That's the biggest comment that I get from your patients.
That's good, because at the end of the day, it's not just come in, get an operation, and leave. At the end of the day, it's really about changing your life and making decisions that are really important to, you know, help you for the rest of your life. And you're definitely a part of that. I appreciate it. For those people just tuning in, we're talking to Tess DeGange, our certified reflexologist. How do people get in touch with you if they want to talk to you?
Well, they can contact us at your office, or they can email me at TessDeGange@yahoo.com.
That's TessDeGange@yahoo.com, and our phone number at the office is 982-2440, and that's the number where Tess can be reached. And is there a reflexology website on the internet where people can find out more information?
Absolutely. It's Kevin and Barbara Kunz, K-U-N-Z. They are, in my opinion, America's leading researchers on reflexology. They are a wealth of information.
Good. Okay, and so should they just Google that name?
Reflexology Research Center, I think it is, or Research Reflexology, but Kevin Kunz, that's the name you want to Google.
Excellent. Okay, you're listening to Western Medicine, the reality behind plastic surgery, the humanity behind the vanity, on Top 1260 KTRC. We'll be back next week, so please tune in, and if you have any questions or comments, please give us a call, 982-2440, and we also love your emails.